Welcome to our second Bear Update. This is a monthly series we are doing special for our Diamond Society donors. And it is October. This month we are going to be tackling vision, eye health in a virtual world. And I am honored to be joined by my colleague, teammate, fellow board member, and truly a friend, Dr. Luxme Hariharan. So welcome. Thank you so much for joining us tonight. How is your October going so far?
It is great. It's my favorite holiday is Halloween. So I'm so excited to
That's great.
And see what all the kids wear when they come in the clinic.
What are you going to dress up as?
I am still on the fence, but I'm thinking an alien. But it's
I like it.
Or Princess Jasmine. So we'll see.
I love it. If we have not met yet, my name is Michelle Boggs. I'm president of Nicklaus Children's Hospital Foundation, and I've been with the hospital about 2 years. And really am just so grateful each and every day to raise critical funds for our wonderful patients and their families. I say it a lot. I think I have the best job in the world. So thank you to all of our Diamond Society donors for your support. We really would not be able to do the amazing work we do without you all. So thank you, thank you, thank you. So the plan this evening is I will formally introduce Dr. Hariharan and all the wonderful things that she does. And then she's going to give us a brief presentation on eye health. And then we will segue into the best part of the evening, really, which is our Q&A. We want to give you all the opportunity to ask any questions you may have for Dr. Hariharan. So as a reminder, please type those into the chat box and I will do my best to get to all of them this evening. So welcome again to our second Bear Update, Eye Health in a Virtual World. So Dr. Luxme Hariharan is a pediatric ophthalmologist within the Division of Pediatric Ophthalmology here at Nicklaus Children's Hospital. As an accomplished global researcher and child health advocate, Dr. Hariharan has a passion for international health that is deeply rooted in her own background. She earned her medical degree from the University of Wisconsin School of Medicine. She completed a residency in ophthalmology at UPenn, followed by a fellowship in pediatric ophthalmology right here at the University of Miami, Leonard Miller School of Medicine, Bascom Palmer Eye Institute. Her work has been published in peer-reviewed journals, and she has written textbook chapters on childhood blindness prevention. Her life and career passion is to create and scale effective programs and policies to prevent, diagnose, and treat childhood blindness and vision disorders, both locally and abroad. She's been awarded the University of Wisconsin Alumni Foundation's Forward Under 40 Award and named a 2014 and 2015 White House Fellow, national finalist for her leadership in public service. And as I mentioned earlier, she is also a proud member of the Nicklaus Children's Hospital Foundation Board. So, Dr. Hariharan, I will let you take it from here.
Thank you so much for that very kind introduction, Michelle. It is truly an honor to be with you all today. People call me Lux or Dr. Lux, so please feel free to say that my last name is a little hard to pronounce, Hariharan. And I want to first say thank you to everyone who's joined in and to anyone that supports our Children's Hospital and our amazing foundation. Really, it's because of you we're able to do all the work to help unleash the potential of children in South Florida and beyond. So thank you. I'm going to play presentation. See if it, can you see it now?
I can see it.
Okay, great. View slideshow. Let's just get this. Okay, so I put together some slides just to give us a little roadmap of where we're going tonight. But again, I want this to feel very informal. I want you to think of any questions. This is just us getting connected to you all as a really remarkable Diamond Society, and what you do is very special. And so we're very just grateful for this opportunity to spend some time to connect. So this is, the background is where I've come from. There's nothing to disclose, and all the images that you'll see, I've gotten consent to share. And just by way of my background, I mean, we have, now is the time where global connection, we're seeing this with COVID, how we are all connected wherever we're from. And I am originally from India. I lived in Kenya. I grew up in the Midwest, Wisconsin, and I've trained on the East Coast, the West Coast, and recently in Miami. So I'm so happy to be back in Miami and serve the communities we serve here, which are very diverse. And most recently, the last 3 years, I actually spent doing global blindness control, childhood blindness control work in countries such as Mexico, South Africa, and Argentina. You'll see some of the photos from that, and also working at the World Health Organization on policy and blindness prevention, Geneva. So I come with this background in advocacy, and that's really what you'll see, but we're all in this together. And if anything that's COVID's taught us is we really have to rely on each other for solutions. And so right here at Nicklaus Children's, I'm so honored to be part of this family because you can see it in the mission, in the vision. Everything is about collaboration, advocacy, and transformation. This is prevalent in just in this Diamond Society series that we're doing, is we're all about connection, and we got to work together. If we're going to solve complex problems, we need different people at the table. And you'll see that theme in what I'm presenting, that solving childhood blindness is not just by ophthalmologists or eye care professionals. It's going to need everybody at the table, including private sector, academics, and government. So one of my mentors used to say, Lux, keep things simple. And so I want you to remember these two images. One is from a farm in Wisconsin, and one is a 5-legged stool. We're gonna come back to this, but just kind of lock it in your memory. It will all make sense shortly.
Farm and 5-legged stool.
Yes,
Got
farm silos, farm,
Okay.
5-legged stool. Just lock this in. And just to give you an overview of where we're going, I'm gonna talk first about what is blindness and childhood blindness and why is it important? What are we doing right here in Miami in terms of, and NCH in terms of this in eye health? And then what's happened recently with the new virtual world and COVID, and how we have to adapt things such as eye strain that's coming from this. And we have launched a Blink 2020 campaign, which we will highlight. It's just a roadmap. So before we solve any problem, the key is defining the problem before you can come up with the solution. So I want to define blindness and visual impairment with this slide. And as you can see, blindness, it says 2200. And you'll note, when people say 20/20, it's perfect vision. Someone has 2200, what that means is they can only see at 20 feet what someone should be able to see at 200 feet. So that is why that you can see them. This is the scale that the World Health Organization and Lancet Global Health uses. And this is a great map. It shows the prevalence of visual impairment. And you can see that it's, you have higher prevalences in areas of poverty in India, Southeast Asia. But what's not clear is that in the areas where there's lower prevalence, it disproportionately affects the most vulnerable communities. Blindness and visual impairment, 90% are in communities that are poor, vulnerable, including women, children, and rural populations, which is not clearly evident in this slide. Another slide that I love to show, just to show the impact of visual impairment, is if you look at the world's population, it's about 7 billion, and a piece of this pie, 285 million, is visually impaired. So how much is that? If you think of the country of Indonesia, this is about 35 million more than the country of Indonesia, which is the 4th populated country in the world after China, India, the US, and Indonesia. So if you take this piece of pie of visually impaired, about 14% are blind of that pie, okay? And what makes this even more alarming is that 80% is preventable or curable by things that we know how to do, such as vision screening, glasses, surgery. So that's why this is so important that we solve this issue. And causes of visual impairment and blindness in adults, top 3 causes: glasses, uncorrected refractive error, cataracts, which you might know of your parents or is more in the elderly when the lens gets opacified, but we can remove it with a simple surgery. And causes of blindness include, again, cataracts and uncorrected refractive error. We're seeing less and less due to infection because of our great control with different organizations. Now, so it's as simple as glasses. We know that glasses itself can help empower people to see and decrease the burden. But how does this translate to children? Because that's what we're all invested in. And like I said, 70 to 80% of visual impairment is preventable with timely screening, low cost interventions, and 90% disproportionately affect the most vulnerable communities, including children, elderly, rural communities. And in children, it just differs depending on the socioeconomic status of a country. There's about 5% of that is of the blind are children. And you can see that depending on higher economic status countries, we see more things like lower refractive error, amblyopia, which is lazy eye, which is going to, and retinopathy of prematurity, premature infants we see in middle income. And then lower income countries, we're still seeing infection as being some of the causes. So it differs. And like I said, 60 to 80% are preventable. And we know that with vision, 80% of learning in a child is visual. So this is really important in unleashing their potential in terms of what they can do. And it's important to note that the visual system in a child is completely different than that of an adult, because your brain, your pathways are still forming. And we have up until 10 or so that we know that there's plasticity in the visual pathway, and interventions such as glasses and patching and surgery can help change a child from 2200, like I showed you, to 2020, just by doing those interventions in this time period. And the reason it's so critical is that oftentimes a child can't tell us that they can't see if one eye is worse than the other. And that's why I think partnering with schools, things like vision screenings where we're closing one eye and checking can help us note if they have a visual problem or behavior issues. Sometimes you'll see children who just are angry or getting frustrated, but it's really because they can't see. I had a patient that actually flunked 2 grades, but it was only because they couldn't see. And once they got their glasses, they were top of the class. So it's really critical in children especially. So now I like to show you the faces of childhood blindness, because to me, this is the why that we're all here tonight and why it's important. This is Fatima from Niger, and you can see that she has flies on her eyes, and she suffered from trachoma, which is spread from chlamydia, which is, we know that face washing, just access to clean water is one of the things that can prevent this. We're seeing less and less of this. This is a blind school in Argentina. These kids had retinopathy of prematurity, something that we screen right here in our NICU. Premature infants are at high risk, but it can be preventable if caught early and treated. These are babies in the NICU in El Salvador. You can see the lack of access to resources. You get 3 in an incubator, and it has to do with oxygen and as a risk factor. This is from a blind vision screening in a school in India. And the great thing here is that we go to the schools and the children get their glasses at that same day that they do the vision screening. And the teachers, here you'll see this is a teacher that's involved with the vision screening, which is so important because they can see how a child's doing in school if they're maybe sitting at the front of the class or not participating. So we got to incorporate everybody as part of this group. And we have an amazing school vision program, or school health program, that we are working with on the vision. And you can see here, this girl's eyes turning out. That's an example of strabismus, which I'll talk more about. Again, that can be corrected with things like patching and glasses if we do it in the early time frame before they're 10 or 11. This is a famous person that you might all know. Stevie Wonder was blind from something that we could have prevented, retinopathy of prematurity. He was there in the decade that we didn't know enough about it in terms of screening. Now we're seeing less and less of this. Thankfully, kids going blind from this in middle and low, higher income countries. And this is one of my favorite patients, Karthik. This is why we do this work. He had corneal scarring and just received 1 transplant. And after his 2nd transplant, someone asked him what he wants to be when he grows up, and he said a superhero. And he used to be so shy and his affect and not participate, but this unleashed his potential. And now he wants to be a journalist and a scientist. So really, Unlocking vision is unlocking potential in these kids. And right here, we have our why right here at Nicklaus Children's. This is a patient that came to us through our emergency room with our hospitalist service, and she had gone to several different hospitals, and until she came here, we were able to treat her with the membranous conjunctivitis, and she got cured. And her mother said she was so grateful with the care she received here because her personality changed and the baby's personality changed. And so that's just beautiful. And this is another patient. You can see the smiles that we're bringing when we're taking care of vision. So really, this is our why. If you want to look at dollars, stuck, it's not moving. I think it loves this slide. Okay. If you want to look at dollars and cents, we know that every $1 in prevention, it saves $4 in the economy. It brings back 4. So this is why it is so important that we invest in this. And having a little technical, this slide doesn't want to move forward. So
it would not be a virtual event without a technical difficulty.
Yeah, okay. So that's, but this is the why. And I think what I want to talk about now is that what are things that we can do to prevent. So one of the things I mentioned is the vision screening. Let's see if I do, let's see. If I do escape, okay. If I hit escape, will it go out? Does anybody?
It should.
Does not want to. Maybe if I hit stop share. Huh. Okay. There we go. Let's try that one more time. Sorry, guys.
No problem.
All right. Is that working? You can see?
I don't see anything yet.
Okay. Let's see. Share screen. All right. It should just share.
There we go. I see something.
Okay, there we go. If it's not, okay, well, if this doesn't, I'll try it for one more second. If it doesn't work, we'll just keep moving forward. So where I was there was to showing you the why, and why it's so important is unleashing the potential in these children. Now, what we're doing here right at home in Miami, one of the biggest obstacles that we have with vision is access. And so right here, here in Midtown, for example, at Children's Hospital, we've had the clinic for about 7 years, and we know that why it's important that we say we see you is because a lot of the kids that don't have access to certain insurances, they get delayed in terms of coming into the clinics. And so we take care of kids with all the different types of insurance. Actually, we're one of the top 2, I think the second children's hospital in the country that serves Medicaid, with the number of Medicaid, second to Children's Hospital Los Angeles. And it switches often from 1 to 2, 2 to 1. And so that just shows you that we open our doors to everybody. Every child, it doesn't matter what their insurance is, we see them. And the problem is that oftentimes they get delayed from different places. And so like I mentioned with amblyopia or strabismus, if you're not coming in early enough for those glasses or this treatment, and they come in delayed, then we can't address the issue at the right time. And so this is why it's so important that we have collaborations with funding and donors to help address some of the bottlenecks that we have in terms of access. And one of the things we're partnered with the NCYA, which is very exciting because they have helped give us funding to get access to glasses, things just such as glasses. Some insurances don't cover glasses, and so they've helped with that. And even some of the bottlenecking, making sure that there's access, that we can catch some of these kids as soon as they're done with the vision screening, that we get them right into our clinic. So those are some of the obstacles that we face, but one of the solutions is not working in silos. If it was just talking to other eye care professionals, we'd all say kind of the same thing, that it's hard when a child gets in delayed. But if we look at the root cause of that and make sure that we're communicating well with pediatricians, we have good advocacy campaigns and education campaigns on why it's important for them to get in. Some parents don't understand that time frame as well. And so this is where we use our resources to collaborate with marketing, with school health and the community to make sure that that message gets clear, and so we can get access. So in terms of funding opportunities to address childhood blindness locally, it's really how do we address our patient population right here at Children's, that we know is one of the highest Medicaid patient populations in the country, in a state of Florida that reimburses the least that we know for Medicaid. And so this is where, we're taking care of the kids that a lot of people don't want to take care of just based on insurance. And so this is where that's one issue. And then access to glasses is another. And then also innovative technologies to help us take better care of our patients, not just with physicians, but as nurse practitioners, thinking of things like virtual documentation and medical documentation is all things that can help. And so those are some areas that you can that we can go into that can help. And the reason that I had the silos versus the stool is because I want to think of collaboration is what breaks those silos. And so when you think of a 5-legged stool, I think of 5 things right off the top of the bat that can help with solving blindness right here locally. It's academics, nonprofits, private sector, funding from CSR, private sector, local heroes, local doctors, local advocates, local physicians, nurses, eye care community, and government. And so all 5 together is what is going to cause impact and unleashing potential. So it's not working in silos, it's breaking those silos and actually working together on these initiatives. Because as I will tell you, if you're sitting around the table and coming up with a solution to a problem as big as blindness, especially blindness locally, you got to have diversity of thought in order to have a good solution. And so you got to have different minds that are at that table, from business to law to medicine. And that's what I've seen in my last several years of working in this field that has been the greatest impact. That's why I'm so honored to collaborate with all of you, and any ideas you have on this that you could help us with some of these bottlenecks, we're super grateful. And one example of where collaboration has worked is right with our Blink 2020 campaign. And I had a link to that, and we'll send that out to you guys after this talk, and it's on our Parents Connect blog. And the reason we came up with this campaign is because a lot of the kids, in this new virtual world, we weren't used to all the devices, and they were complaining of things as eye strain and ocular dryness. And so we came up with a simple 5-step strategy for you to remember things you can do to help this. And it's based on 2 premises. One is that blinking is the natural way that the eye gets lubricated with tears. And when you have devices, what we know that the normal blink rate is about 30 to 35 times a minute. But when you're in front of a computer device or any device, that goes down to 5 to 7 times a minute. And so therefore you're having very dry eyes that can often present as irritated, burning. You can get eye strain, headaches here because you're concentrating so long on a near device. So what the Blink 2020 is 5 steps. B is for blinking. So just remembering to blink every 20 minutes, look at something 20 feet away, 20 seconds, blink for 20 seconds. That's a reminder. You can put up something that you like to see. If it's a kid, you can put up a game or a basketball or something to have them focus every 20 minutes, at least every hour, but every 20 minutes is ideal. L is for lubrication. You can buy over-the-counter lubricating drops. You want them to say preservative free. There's ointment and drops. There's several different brands: Sustain, Genteel, Refresh. And that throughout the day, you can lubricate your eyes and put a little ointment at night. It really helps with the dry eye. If you're a contact lens wearer, I would recommend removing the contact lenses and using glasses, because the contacts can dry your eyes. So these are simple things, or having a humidifier. I is for inches. So the setup of your computer, you want it to be about an arm's length 25 inches away, and you want to look downward at a 15-degree angle, because that way your upper lid can help prevent tears from evaporating. Again, one of the causes of eye strain with all these devices is because your tear film is not moist enough. And so that's one thing that can help. And then, so that's eye, and the setup of the computer too, contrast, glare, lighting, all of that can help. As parents, we can adjust that during the virtual learning time. And then N is near device breaks. This is one of my favorites because I've had patients come in saying, Dr. Lux, after a long day of virtual school, I go to my iPad, and then I go to my video games, and then I text my friend. And I say, this is not gonna help you guys, because what you need is go outside, play, jump rope, play with your pets. You need to have complete device breaks. And that includes phone and video games, and anything that's a device is something, especially during this time when we're not used to so many hours in front of screens, it's even more important. And then K, finally, is know your sources. There's a lot of misinformation out there, and that's where it's so important to rely on your physicians, your resources such as the American Academy of Ophthalmology, American Association of Pediatric Ophthalmology and Strabismus. They have a lot of great resources, what is evidence-based and what's not. For example, a lot of people have asked me about blue light protection and spending a lot on blue light filters. And first and foremost, anything you have to spend a lot of money on is a red flag, because it shouldn't have to be something you have to spend a lot of money on. And there hasn't been any evidence that has proven that blue filters actually prevent strain from computers. We do know that it can help sometimes with migraines and certain things, but there's nothing that is evidence-based that shows that it specifically helps with the blue light in computers. So that's something just to be aware of. If you have if there's just like a $10 one from Amazon, that might not be too much of an investment. But if you're spending over, a lot of money on something like this, please talk to us first, and we can work with you to figure out if it fits or not. So that's our Blink 2020 strategy, and we've highlighted that in locally in the news on Univision, and we're working with some national organizations that I mentioned to help spread the word on this simple thing.
And Dr. Lux, sorry to interrupt you, but yeah, we will be sure when we send out the recording, we can include materials and resources on that campaign.
Awesome, that's great. And yeah, and I just want to end with a few last thoughts, and just to say that really it's such an honor to come to Children's and getting to work firsthand with all the innovative thinkers and really very action oriented. This was an idea that we came up with in April and May, when we noticed this. And then it took from an idea to actually having impact by having an advocacy campaign, which I think is so important because it's for the kids. And so I want to leave you with one of my favorite quotes. Or South African proverbs, I would say. If you want to walk fast, walk alone. But if you want to walk far, walk together. And I really believe this, because this is how you solve problems like global blindness right here in Miami, and any issues that's coming up with virtual world is through collaboration and doing this all interdisciplinary and as a team. So thank you very much.
And thank you so much. That was wonderful. Can we go into Q&A?
Yes, absolutely. I'm sorry.
Right.
I can send you guys the slides that I had, but it was just more photos, a lot of photos.
Great. I think that, like you said, was probably the best part. Okay, so I'm going to move on to a couple questions that have come in. You may have answered this first one. What can I do to protect my child's eyes? We talked about the Blink 2020 campaign, but this person is curious about those blue light blocking glasses. So it sounds like maybe if they're low cost, might be worth checking out, but don't do anything above, a cheaper pair on Amazon. Is that accurate? Okay.
Yeah, or just talk to us. I think that's the key, is talk to a medical professional on why you need it, what is bothering you, what your symptoms are. Because like I said, there are certain situations where it might actually be helpful, but there are certain where some of these other methods that are low cost methods can help first. And so that's what I would say is talk, have a conversation with us. We have a great team here at Children's, and we're happy to help you.
Okay. With increased screen time, should we visit the optometrist more often?
So it depends on symptoms that you're having. So if you are having some of the common symptoms that occur are some burning sensation, irritation, tearing. From tearing, it's actually counterintuitive. That can be dryness, can actually produce more tears, or strain in headache. And like I said, this 5-step strategy, trying some of these things out first, taking some breaks, doing some lubrication, is probably the first step. And if it still persists after trying some of these strategies, yes, I would, come to see your eye health provider, either an optometrist or an ophthalmologist in your area that's focused in pediatrics would be beneficial to just discuss again. And even your pediatrician, they can refer you. And I think the key is not to feel alone in it and realize that there are resources to help you on this.
Great. You talked about symptoms. This person wants to know, are there particular signs of vision strain in my children that I can look out for, specifically any physical behaviors or mannerisms they may do that could be a sign of vision strain?
So one of the things that is a sign is blinking a lot because you have the dry eye or headache, like I mentioned, because basically it comes from straining too long at near your muscles, your neck. It produces a lot of tension. So that's why it's so important just having breaks and taking the time to actually, so that's why I say setting a timer is great, because you don't realize you could spend hours and hours on the computer without taking a single break and not looking even at the distance. So I would say that eye strain, headache, or burning are all common things that we see with prolonged computer use.
Okay, great. Do you have any tips or tricks when wearing glasses or sunglasses to reduce fog when wearing masks?
Yes, actually, because this was happening, it actually happens in the operating room when we're doing surgery, because we have to wear masks in the operating room, and we often have these loops. And what happens with the loops is they get fogged. So what we do is we put tape right on the top of the mask. You can get like this clear plastic tape, and that works beautifully. You can use that tape, so it if you have your glasses on, it can help prevent that air from going up. And so it's funny, there was and part of the environmental staff, the cleaning staff, he wasn't wearing his mask in the elevator. And I asked him, why are you not wearing, your mask? And he said, Doctora, it's because the fogging happens and I can't see. And so I just gave him some of the surgical tape that we use. And he's like, this changed my entire life, because he's been pretty much not able to use the mask because of that. So just a simple thing as plastic tape can help a lot.
Great. Can you say again, I don't recall, but this person's asking, how far from the screen should my child sit?
So some of the studies out there have shown that arm's length, or 25 inches, is one of the, what we know, and then lighting is key. And, there's some studies that from American Academy of Ophthalmology on something called computer vision syndrome, which is when you have a lot of these symptoms after a long time, and that's where they're talking about the setup. But really, about an arm's length, 25 inches is what this article said.
Great. I'm just checking if we have any other questions. No other questions, Dr. Lux. Can you really quickly walk us one more time through what the BLINK acronym stands for? Because I think that's where probably the most meat of what everyone will learn is going to come from.
Sure. And again, there's on the Parents Connect blog, we have a great little pamphlet on this, and we also are in the process of making a little video that we will put up at the Children's Hospital. But the BLINK stands for just blinking. B is for blinking more frequently, because again, you have a decreased blink rate when you're on computer devices for long, and blinking helps lubricate the eye, keeps it moist. So blinking more frequently, every 20 minutes, look at something about 20 feet away and blink for 20 seconds. That's a kind of way to remember that. It also helps you take away from focus at near. That was something that we saw in the American Academy of Ophthalmology. And then L is for lubrication, getting artificial tears over the counter, get them at CVS, Walgreens, preservative free. It should say it on the bottle. That's the most effective. You can lubricate your eyes with ointment or tears.
And is that as needed, or it'll say on the box how often?
I would do 3 or 4 times a day, as frequently as you like, because it's really, you'll notice a difference. And actually, I recommend the ointment at night, because when you wake up, your eyes are nice and lubricated, and tears throughout the day. But that is something that has really helped people, as long as it says preservative free. That we find sometimes if there's preservatives, it can irritate the eye. And then even just removing contact lenses. So then that is L, lubrication. I is inches, the setup, taking the time to set it up, 25 inches, looking downward. That 15-degree angle is something I read about, because I didn't think about that, that your upper lid helps your tears from evaporating. So that actually does make a difference, looking downwards. And then
that's not good lighting for us though, right? Don't we like to look up?
Yeah, we like to look up. So that's why I was like looking down. And then the, and the contrast or glare on the screen, all those things. And then the inches, that was inches. N is for near device breaks. So again, play with the pet. Don't go from computer to iPad to video games. And then K is know your sources.
Great.
American Academy of Ophthalmology will send some links out, but basically ask us. You have great, people in your corner, pediatricians, optometrists, ophthalmologists. We're all here to help you. So don't go to Dr. Google, but actually it's good to kind of, pick up the phone. We can do a virtual visit. There's many ways to connect. So I really encourage connection and communication on these issues before trying out different things.
Wonderful. Thank you so, so much. Our hospital and community, we're really lucky to have you. So thank you for joining us this evening. Our Diamond Society members, thank you all so much for taking the time to learn about vision health and for welcoming Dr. Lux into your homes tonight. We will send out the recording and more information on the Blink 2020 campaign. Wishing you all a wonderful evening and a happy and fun, safe Halloween. Take care.
Thank you so much.
Bye-bye.